Now to an alarming new trend. The coronavirus is hitting African Americans worse than others. In Louisiana, more than 70% of the nearly 600 deaths connected to coronavirus are Black. But why? David Gonzalez explains.
It's a tremendous challenge. It's terrible.
President Trump reacting to data that shows African Americans are being hit hard by coronavirus, calling it disproportional. In Houston, numbers on the impact the virus is having on Black communities are unavailable. But Mayor Sylvester Turner says health disparities have always existed in minority populations and are heightened because of COVID-19.
People who are in low-income communities, people who have underlying health conditions, hypertension, diabetes, renal failure, all of those things will help to accentuate their situation.
Health experts agree. They say the virus isn't targeting a specific group, but because higher percentages of African Americans or Latinos live in poverty, if they get the virus, they may have more health problems or deaths because of underlying issues.
This disease causing bigger problems in minorities, it makes sense. And it's something we have to keep an eye on because these people are at higher risk of bad outcomes.
It's something they have to keep an eye on. Experts say while it's hard to immediately change the impact pre-existing conditions have in these communities, you can do something to curb the threat of coronavirus.
So the best way to help everyone would be decrease the amount of exposure.
That means social distancing. In the meantime, the city is working to improve access to testing sites to those who make up these vulnerable communities. In Houston, I'm David Gonzalez, KHOU 11 News.